Hello. We're from Lifescape on, is it Memorial Day weekend?
Yes. It is Memorial Day weekend.
Yes, and I am in shorts. I have a nice shirt on. This is my lovely wife, Dr. Lisa Strohman.
I don't think you're supposed to tell me you're in shorts.
Okay. Well, it's Memorial Day, so it's fine. We are here to talk about meditation for the most part. Lisa has to leave for a patient in about half an hour, so we'll try to shoot through this. This is her expertise. I'm just trying to figure it out myself, so use it all the time.
Well, but you have actually been practicing it on a regular basis, like for the last couple of years.
Yeah, I'm a practicer.
Mm-hmm.
I'm definitely practicing. I have a medical practice too, so I'm a good practicer. So anyway, I'm just going to give you an overview of meditation, how I use it. I'm sure she'll chime in on how she uses it, and just some general logic and maybe a couple examples. And then at the end, we'll talk about there's some other options for treatment-resistant depression and PTSD. So in essence, meditation is someone said it's sort of the opposite. So white, black, anger, happy, and then you're either being mindful or you're being distracted in thought. So I kind of thought that was kind of interesting because a lot of times I am in my head a lot and I am always thinking about things. And most of it's around medicine, but
hockey
or hockey, yeah, that'll do too. So a lot of times I'm distracted in thought.
Podcast lists.
Yeah, but I feel like I'm meditating when I do that stuff.
Well, I'll pop in just for a second here. I think in meditation there is a distinct difference between your goal really is settling your mind. Like there's conscious stream of thought, and then there's really getting to the point. So to your point of like medicine and your mind's getting distracted all the time on a daily basis, whether it's family or work or extracurriculars or whatever it is, like we are distracted and our mind goes in different places. So really the practice of meditation is not a conscious effort. In many ways it is like settling your environment, your time, and allowing your brain to settle and like to relax and to just to have that space. So that's a hard thing to do.
Yeah,
because that's not what we're, particularly with technology and all those things.
Yeah, and if you're going to first start it out, you're not going to be good at it, and you're going to sit there for 3 seconds and then 10,000 thoughts will pop in your head. But then you settle your mind and do it again, and you eventually get pretty good at it. But it's always a work in progress, right? So with training, again, you can become more readily available to kind of be tuned into your patterns, like breath and sensation and touch and thoughts and emotions. But with training, you should be able to get better at it. So I kind of like the mindful versus distracted thoughts, and they're just sort of polar opposites. And you're not going to be perfect at every time, but you can get better at it. And meditation can cause some structural brain changes, just like anything you do will cause structural brain changes. So like in hockey, I wasn't unable to skate, probably when I was 34, but now I can skate pretty good. And my brain has changed. And just like meditation, the more you do it, the more you can kind of catch yourself getting in distracted thoughts and try to calm yourself.
Are you equating your brain change of like hockey skating as like it's increased your brain density and changed?
It's changed it. I wasn't able to, your brain modifies just, and even though we're adults, we can still change.
Yeah. Well, and it's true. I think that like in a practice of having someone who's coming in super anxious, super depressed, or having like environmental traumas, childhood traumas, things like that, you definitely see a lot if you look at the brain. Like you definitely see like neurochemical, structural impacts of those things. So settling those things down. I just had never heard of you using your hockey as a way to...
my point was, anything you do consistently will change your brain. Yes. You hear about people saying, mindfulness will improve your brain. Well, maybe not improve it. It'll change it, and hopefully you can catch yourself. And there's also been some studies on, maybe immune system function improvement, maybe your brain cortical thinning doesn't happen as much, so maybe dementia prevention, and it can obviously help reduce stress.
You don't have to go play hockey. We're talking about meditation.
I have to play hockey.
Part of your meditative practice.
It is. I feel like when you're doing something you love, you're just doing that, and you're not focused on 401ks and the kids have to go to this, and it's just like a moment in time when you could just do one thing without thinking about other things.
Yeah.
And so I've listened to many podcasts. I've read a lot of articles. So a lot of this is, I'm gonna kind of gathering it from different sources.
Welcome to my world.
So someone said mindfulness is really simple: to notice the processes with clarity, and to prioritize what you pay attention to, because what you pay attention to is building your mind. So if you're always focused on the worry, like residency, I was like worried 3 years in a row about, patient health, and that mindset is hard to break. It was beneficial at the time, but it's one of those things where once it builds, it builds. So yeah, building habits, building, worries, building depression, building expectations and insight. I listen to Sam Harris a lot. He has a mindfulness app that I use quite a bit, and I'll allude to it later. But
And mindfulness is a bit different than meditation.
Yeah, they're
kind of kissing cousins a bit.
Yeah,
Yeah.
I don't know even how to explain the difference between them. But
So mindfulness is purposeful, it's conscious, like it's really going in and really focusing in on like a body scan. There's like definitely prescribed things that you can do. So you're putting conscious attention to it. Whereas in meditation, you really are trying to let go of putting that conscious thought and allowing your brain to settle and allow thoughts to come and go, which is important, right? This is how like people build resilience, like sitting in an anxious moment. Like I talk about this a lot in psychology. It's like, anxiety is a normal neurochemical response when you're stressed out. Sitting in that and knowing how to be uncomfortable in that situation is what builds that resilience.
Also realizing that emotions don't last forever.
Mm-hmm.
And I know a few people, maybe myself included, that once you have an anxious thought, then that if you just let it sit with you, it will eventually fall away. But if you start another thought about another anxious event, then you're basically promulgating the anxiety or promulgating whatever.
It's a good word.
Thank you.
Yeah.
I went to college.
You're right, though. It's bootstrapping those anxieties.
So your emotions should last this long, but if you start another thought there, then you're going down the line. And
so meditation in contrast to mindfulness, again, kissing cousins, but because there is a lot of mindfulness used in meditation when you're focusing on breath and that settles period, and there's lots of different things. But yeah.
So anyway, the Sam Harris, he had a really good example, and he said, he was like, okay, you got your phone and your phone beeps, and you have this urge, like, or an email pops up, ding. I actually have turned my those dings off on my phone. It's more of a vibratory thing, but anyway, you have this urge. Yeah, and well, I silent it too, but you have this urge to answer the email. Like the email is probably going to be something you have to do, right? It's usually, do something for me. And then you have your, he used an example of an 8-year-old daughter asking you a question simultaneously. So you have this dichotomy of, do I answer my daughter or do I
competing attention?
Yeah, exactly. So that's where mindfulness can come online. So you notice the urge to answer the email as a pattern of your energy, and you have to try to let that go. And if you can try to break that, that's great. And then you become fully present in the moment, realizing, okay, the email doesn't probably have to be answered in the next 30 seconds, but maybe I can answer the question of my daughter now. And he just said, if you're able to kind of break that down in a very short 30-second, email, daughter, that if you break that down, it's a 30-second interval. If you can sort of manage that, just imagine the rest of the day if you make those sort of conscientious decisions. I thought it was kind of interesting.
Yeah.
And another article mentioned about trying to overcome the default mode, and I'll talk about the default mode when we talk about this potential treatment for depression. And it's trying to understand what is your default mode, and people mention the monkey mind. So telling ourselves a story all day long.
It's like 4 out of 5 dentists.
4 out of 5 doctors.
It's not something that I studied in psychology, just for the record, the monkey mind.
But definitely meditating.
I think it's a colloquial term that you're using.
Yeah,
okay.
The monkey mind,
Okay.
Nothing negative, nothing in it.
Because monkeys are jumping around, or?
Yeah, because monkeys are just kind of like,
Okay. No offense to the monkeys.
Yeah, no offense. Hopefully they don't have consciousness, but they probably do, actually.
They for sure do.
Oh, they for sure do.
Yeah.
But it's telling yourself a story all day. I think we have
We're talking about the article, Monkey Mind.
I know, but I was just trying to give examples of I know some people that they will tell themselves a story about what's going to happen X, Y, and Z, and if it doesn't happen in that direction, they get angry and upset.
Oh yeah, so cognitive flexibility.
Yes.
Right, like they start to like choose one path
Right.
mentally and
Right. So
predicting. I tell people they're bad script writers all the time.
exactly. So I guess I don't know, how do you change the script? Like, I mean, part of it I think is mindfulness and meditation at times to train yourself that you can sort of not control your thoughts, because your brain is just going to create thoughts all the time.
Yeah.
But I don't know how you.
Particularly a brain like mine that goes 1,000 miles
Yeah.
an hour. And well, I think that you have to first acknowledge that you are the type of person that does that. Once you recognize it, which is like kind of the first thing, is like recognizing, okay, like how do I in those situations like manage that? And am I using, for me, like, are there data points? What is your narrative, and what do you have control over? So I talk a little bit about that, which is kind of helping people without talking about meditation, about settling their brain and settling their panic or their storyline into kind of like, where are we in that moment? Because that's really what meditation is too, right? It's being in that moment.
Yeah, and if you're always creating a script in your head, you're always thinking about the future. And then if you're always thinking about the past and what you should have done, you're thinking about the past. And the point of mindfulness is try to live in the present. So definitely.
And I don't know what your article is because I didn't read it, but like with a monkey community, let's say, right? They have to be predictive, and they have to be cautious of like people threatening them and all of those kind of things. Very similar to.
Well, that's our minds are trained that way. But
right.
In our modern environment, we are stressed every day at work and school and all these other pressures versus, we used to be hunter-gatherers, and we'd be stressed for 20 minutes at a time trying to fight an animal or kill an animal, where now it's just like hours 8 hours a day are in this stressful.
I mean, we watched 1883. It was more than 20 minutes. You
20
were
minutes
stressed all the time.
No.
Like
in bursts, right?
Okay.
Yeah, bursts of.
I have a lot more respect for my my generation
and
before me.
Yeah, absolutely.
Yeah. Not an advertisement for that, but
yeah, it's a great show.
Yeah,
I love that show.
Yeah.
But I think in mindfulness, I have learned that I have a monkey mind similar to yours. Maybe I don't say things out loud as much as you. You just, whatever comes to mind, it's.
I'm way better at that.
You are better.
I'm not, like, I've developed a better filter.
But I feel I'm in the same position, but I just don't say the words. Like my mind's always and.
I would say that's
yeah.
very accurate.
I feel like mindfulness and meditation has helped me figure out that, okay, I'm aware that I have these nonstop thoughts all the time, and I don't have to have the thoughts drive me. Just because it's a thought, just because I think, oh my God, there's a plane right there, it might crash, it doesn't mean it's going to be predictive. It's just like, that's just a thought.
So you just watch it go by, or
you watch it go
hang
by.
on to it.
Right, exactly. So anyway, so you don't want your thoughts to own you. Your thoughts are your thoughts, and you can pay attention to whatever ones you want. But as long as you kind of become aware that those thoughts are always kind of popping up all the time.
And what are the health benefits of meditation? Or
well,
we're not here. We have a huge script. We have lots of notes here, so I don't want to jump ahead.
Future. No. There's not a lot. I mean,
there's a ton of benefit.
I mean, there's benefit, but I mean, the benefit, it's cortical thinning and maybe depression treatment and becoming less anxious and having better outlooks on life and end of life care stuff we'll talk about. But again, if you can sort of at least catch yourself, doing mindfulness at the time for 5 minutes at a time is difficult, and then you start building it and you can do it longer. But the point is, can you do it in real life? Like when I'm at work or when I'm at home, like in those cases, you try to engage it. Then mindfulness practicing is doing it in short bursts to figure out if you can, at least kind of tune into it. Mm-hmm. So trying to apply it to real life is much harder, but it definitely can make impact. Mm-hmm. But the default mode, I was mentioning how we're always thinking about the future or the past. We went to Disneyland, and I don't know who mentioned it, me or you first, probably you. That at Disneyland we had this app, mm-hmm. and we'd go on a ride and we'd get in line, and we're like, okay, next ride. Before we even enjoying the ride we're currently in line for, the minute we scanned, we're like, boom, okay, let's go. Let's look for the next ride. and we just kind of commented like we're always thinking about the next thing and not the present thing.
Well, and I think that our experience at Disneyland growing up without having that technological influence was very different. So we were able to look at how much more we were engaged prior to
That's true.
versus like what we were. So like I think I don't, our kids probably, which is a big point of this is like for the young kids is like that they really don't have any experiences that aren't really pressured.
Except like ocean trips, like, and we're out in the ocean swimming for 3 hours at a time. I feel like that's
like getting out into nature, unplugging,
Yeah.
all of the stuff that I talk about. But like not every kid gets that opportunity, and not every parent understands the importance of that. So,
But I was just thinking, just Disneyland
downtime.
was anti-mindfulness,
yeah, it was very busy.
I mean, it was just kind of crazy, kind of how we kind of processed the day. It was fun, obviously, but it was always like, what's the next thing? What's the next thing? What's the next thing?
Yeah.
So there's sort of two main types of meditation now. There's concentration-based meditation and mantra-based, where you see the people with Om, and they're focusing on that noise, and they're trying to, like, any thought that comes up, they just sort of not ignore it or let it pass and just focus on the now. And
With like sound bowls sometimes.
Yeah,
Where they're
yeah.
doing stuff. Yeah.
so there's that. So it's mantra, where you mantra a sound or color in nature, just something. And then there's mindful meditation, where you're just trying to take a break from the spell of your distracted thoughts, where you're noticing, hopefully you're noticing them clearly. And if a thought comes, it's not that you don't want the thought to happen, because it happens. You just want to not give it a bunch of credence, let it pass, and then hopefully you can focus on, the present, and not, again, 401ks and future dinners and plans and what we're doing this weekend, and gas prices are $5.50 now, and
That's what's going on. I want to say, like, from that mantra, like, I think that sometimes those sounds and that practices is like, it's important to recognize that that's for the atmosphere, and the predictability of it helps cue people, and it helps the practice of meditation sometimes. So kind of those sound bowls or the Om or some of those traditions, which are not actually based in Buddhism, but Hinduism. I don't know if you know the history, but anyway, it's thousands of years old. And so there's like a lot of like history and like kind of cool stuff, like when you look at that. But anyway, that helps cue and like set the mind into that, just like
Yeah.
you would be cued, like the Pavlovian,
Yeah. And
or-
I've tried different types of meditation. Mindfulness meditation seems to be the one that sort of resonates with me. But every person, again, there's multiple variants on these things, and whatever it is, I mean, the whole focus is sort of the same thing,
Right.
generally speaking.
Right. Yeah, these are only just two examples of meditation.
Yeah, there's
that
two
you're-
main groups, and the Vipassana is the one that's the oldest Buddhist practice, where they're kind of focused on impermanence, nothing's forever, trying to be selfless, and then focusing on not suffering from suffering. So, an example is our son's going to get a vaccine, and he remembers it, from last time, and so he's going to get a vaccine in 2 weeks. Well, okay, he's worried about it, and he was talking about it the other day, and I was trying to mention, okay, you can suffer the 5 minutes it hurts while it's going in, or you can suffer for 2 weeks thinking about it, and then suffer the vaccine itself.
Maybe that sounds like
me. But I'm better now. So anyway, well, we pass on genes,
I know, epigenetics.
I passed on the athletic gene,
Oh, okay.
and I
All right,
gave-
here we go. This is not. We're talking about meditation.
and I gave him that too. So I was going to mention a couple examples. So I don't know about this one. Oh, negative emotion. So negative emotion, like being sad or angry or mad, and it can perpetuate itself. So in a negative emotion status, if you're able to kind of meditate, you can sort of get out of it faster.
Think about like layering of like if you kind of stop yourself. I don't know, like as a teenage girl, I remember I'd just be like angry and I had no idea why. I was just like pissed at the world, and there's like no reason for it.
Yeah.
You just wake up angry. And now it's like, as a psychologist and trained, it's like if you can get people to kind of separate and like understand and like watch and see what is loading into the negative feelings and the
Yeah.
anger, right? And like separate it from yourself and acknowledge it and then let it go. That's the part that
And
meditation can help with.
yeah, and then you're never not going to be ever angry again or sad again. Those are all natural thoughts, that happen. And if you can, key in on it, and be aware you're going down that pathway, or figure out, okay, why am I feeling bad? Like, why am I feeling angry? Then you can kind of slow the process down. You can maybe get to the base of it and maybe figure it out that way too. But again, you're always narrating it to yourself, and hopefully we can't control those emotions, but we can become aware of the thoughts that are perpetuating it. That's my point. Is if you can be aware of the thoughts that are perpetuating whatever emotion you are. Hopefully, you can kind of get a little better control. And I was thinking about this the other day. I was looking, who's in the present moment. I think I was mentioning dogs and little babies. Like they are in the moment. Like a dog is, whatever he wants to bone, boom, bam, and then he'll rest and nap, and then they're just always in the moment. And 2-year-olds too. And I think we're teaching, obviously when that 2-year-old is growing up, we're trying to teach them what's their place in society, and maybe some of that is how they should behave, which is useful, but maybe that sort of hits us on the end, when we're adults. Like, I don't know, I thought it was kind of interesting. Let's see, anger. Trying to notice the emotion again quicker. And again, you can never not be angry again. But you should focus on the real focus and trying to notice the energy first. And I was sort of mentioning how we can frame things. And I mentioned this, I sold a car in Texas, I sold a car.
You sold the car here.
I sold the car here. It was going to be shipped to Virginia. And suddenly the guy basically reneges, and my car's on a 3,000 mile trip to Virginia with no capability of stopping the car. Anyway, ended up having the car stopped in BMW of Dallas, and so I had to go to Dallas and then drive it all the way back. And
after being like hoodwinked and swindled
and angry and very emotional.
I did not join him on that trip.
So I could have been pissed off and angry the whole time, but I kind of reframed it like, oh, I had this stoic 5-hour, 6-hour lecture series that I had no time to do. And so I just reframed it like, okay, I have to drive for more like 12 hours. So I listened to it twice, but I just reframed it. Okay, well, it sucks. I lost some money. At least I got my car back. And now I reframed the drive like, oh, I had time to meditate. I had to, not meditate. I had time to listen to this lecture series that I wanted to listen to. So reframing can be actually pretty helpful. Another example, boredom. This is something that Lisa in technology, our kids really never experience boredom anymore. There's always a gadget available. There's always, hold on, I gotta text somebody. There's always this sort of inability to be bored. And I just kind of, what do you think?
Well, I mean, I think that again, like when you teach, like, bringing it back to the meditation, like if you teach kids how to sit in a settled brain, it's actually redefined.
An
it's not
unsettled
boredom.
brain?
No, so if you have quiet moments and you're not pressed with academics or sports or whatever it is that's going on in your kid's life, and they like, I've got nothing to do. If you actually like kind of like your trip to Texas.
Yeah, I had nothing to do.
Texas,
yeah.
It's like, like when you're in that state, if you like let them sit there and like enjoy that moment, that's a meditative state. Like you don't really have to tell kids like, well, let's meditate, because no kid's going to want to do that.
Yeah.
But if you teach them to sit in that kind of feeling of like just letting themselves relax, because that's the part that I think with the pressure of technology and things like that, like they never let themselves have a break or be offline, or like their brain is always looking for the buzz or the beep or the the next cueing or the message. So I think that again that's boredom is, to me, should be coveted if you have the ability to have that space. But we have to really talk about it in different ways.
It's like having an ability to be alone, and then at that point pay attention to what your thoughts are. So I feel like this thing is probably the antithesis of being mindful, isn't it? I mean, it's
Yeah, which is interesting because they have like meditative apps and things like that you can use.
Yeah, I mean, obviously there's roles for technology to help you, but there's obviously negatives, and I don't know, negatives outweigh the positives maybe.
Yeah.
Um, yeah, so I thought boredom was kind of interesting to think about. Our children basically, not brainwashed, but they're basically hooked on technology, which is the antithesis of just being out in nature.
Yeah.
And then I saw an example of grief and losing a parent or child. And I don't even know I want to go down this road, but it was trying to just frame if you lose someone, well, part of it's just being, the dread of losing another child. Like if you lose a child, lose a parent, there's part of it is like, okay, I lost that person. Who's the next person I'm going to lose? And you can get in. I actually just saw a patient recently that did lose a parent, and their first thoughts, or a friend, and the first thoughts was, oh, and I'm going to lose probably this guy and this guy and this guy, and now you're living in the future again versus maybe just grieving the person that has died in front of you.
And being okay to be in that moment and like experiencing that again, like a lot of times, like with help, like obviously, the tragedy that just happened, it's like there are certain situations that there's absolutely no reason that we would ever anticipate something like that happening. We don't anticipate losing a child before ourselves and things like that. So, I mean, obviously you want to give psychological support around those and like talk to other people, but the meditative piece of like being able to appreciate those moments and like have sadness over them, whether it's your own or like the empathy for others, that they're going through it, right?
Yeah.
But it's okay to have those moments. And
again, it's okay to have those emotions. It's just you don't want to try to promulgate them. And obviously, with bereavement, that can last 3 months, 6 months, years down the road.
Yeah.
And one of my favorite movies is Arrival.
Oh my God.
Watch it probably 20 times.
You have no idea.
I remember I watched it with Cindy and you.
Yeah.
Yeah. But the main character of Arrival, the movie, it's a sci-fi movie, but really I feel like it's a very personal movie. She is sort of eventually learns how. I don't want to give up the plot, but I guess I'm gonna. So if you haven't seen Arrival, don't listen.
Roger Ebert.
So this woman basically figures out she can see the future by learning this language, and the gut of the movie was really her gut of the movie is she had this child. And the child's going to die as a teenager. Would you still have the child? And that was the gut of it. Is she chose to have the child because she had 18 years of a relationship with her, and you miss all those precious moments. And unfortunately, as a human being, we are all going to pass at one point, and we just have to be mindful. Like, let's just live in the present moment because we can't predict the future. I don't know. It's sort of grief, death, and how to lose people. And I thought that was just a really good example of, even if you're going to lose someone, at least be aware of the daily things that happen.
Mm-hmm.
And there's many times, and I've mentioned this to you, is the last time. Like, when's the last time you're going to tuck your kid in? When's the last time they're going to ask you to read a book to them? When's the last time?
This could be our last webinar.
That's true. Let's enjoy it. When's the last time you're going to rub your kid's leg? Which I did the other night, and he had hair on it. And I was like, let's just, maybe this is the last time.
Nice.
So.
All right, we have to end on, I've got to take off for my patient, and you have other stuff to talk on. Is there a happy ending?
Happy ending? No. No. Yeah, just be mindful. I mean, obviously, there's some apps out there. Waking Up's the one I use. 10% happier, calm. There's all different variations of it. My point is, and I've pointed out this app to many people, just try it and just realize you're going to suck at it, and it's not going to be great at first, but you can get better at it. And the point is to learn that you have all these internal thoughts and try to live in the moment and try not to think too much about the future and present. We obviously have to think about future things, but we can.
And you don't normally put this much thought into the thought of you disconnecting thought. This is just for the webinar, right?
This is just for the webinar.
Okay, thank God.
Yeah. So, thank
All right.
you.
Yes. Bye, everyone.
Okay, so I'm going to talk a little bit about psilocybin, which is a potential new treatment option for very specific things. So, I mean, we're talking about treatment-resistant depression, PTSD, any version of that, and potentially end-of-life care. So I'm sure many of you have seen a bunch of articles on this. I just want to give you some information on what's the sort of current regimen, current routine. Essentially, psilocybin is a psychedelic, and essentially there's many others. They basically alter your consciousness. So MDMA, ketamine, which has some studies on depression, LSD, psilocybin, and mescaline. You have a bunch of other drug companies coming up with their own versions, which basically take psilocybin and then put a carbon on it, and then basically they have a trademark on it. And also these companies are trying to come up with means to, how do you treat somebody? You just don't give them LSD and say, okay, we'll see you, have a trip for 6 hours and we'll see you later. There has to be some structure around it. So like some pre-structure, meaning seeing a counselor a few times, during the event having a psychiatrist with you for 4 or 5 hours, or someone trained, and then having some follow-up. So again, I don't want this to be about, oh yeah, I'm going to go try LSD because Strohman told me to try it. There's definitely some structure around this, and there's definitely some risk, which we'll talk about too. But basically, psychedelics, they alter consciousness. They're found in mushrooms. There's a number of indications, what I told you about. And there's some addiction studies on cocaine and heroin and alcohol addiction, which could be helpful too. But all of them have to be studied and figured out what are risk factors, who shouldn't do it, who can do it. Not everybody's going to respond to it. Psilocybin is a tryptamine, so it's sort of a serotonin stimulant. It's an agonist of the serotonin 5-HT2A receptor. It takes about 90 minutes to take effect. It lasts about 8 hours. It's basically out of your body within 24. And again, it can cause illusions, hallucinations, cognitively, creativity, word associations, intensified feelings, which again, if you come into a session and you're being treated for PTSD and you have negative feelings, that might not be the greatest timing for that. So, low dose can cause drowsiness, moderate dose, you get the altered state. And then the high dose, which is for a strong psychedelic experience, most of the companies are studying high dose psychedelics and again, treatment resistant depression. So that means someone who's been on SSRIs, SNRIs, combination drugs, and they're still not responding, that there might be evidence that maybe 2 treatments a year or even 1 treatment could potentially have longevity on, maybe they can reduce their need for those medicines, or maybe they don't need to be on those medicines anymore. But it's all in the context of, psychologic care, psychiatric care. And magic mushrooms date back to 9,000 years ago. I mean, Mexico, 3,000 years ago. So these have been used throughout time. And then in the 60s, I think we started to overuse it as a society. And they started actually testing it for mood and alcohol addiction. And it had some pretty good studies. And then in 1970, the FDA basically classified it as Schedule 1, which means it's very dangerous and it has no medicinal purposes, which then probably put us back in time as far as studies, because now we've started using it again in some studies. So essentially we've gone 30, 40 years on a huge hiatus, and only recently have we started re-examining it. In the 60s, there's, I think, 1,000 published studies, more than 40,000 people in those studies, and there were really minimal side effects and pretty high safety. But again, the context of when to do it, the context of how you do it with, a counselor and some intensified care, because there can be, again, some significant side effects. Let's see. It was banned in 1968. Yeah, 2005, there was a study on psilocybin and psychotherapy on neurotic disorders and alcohol dependence and end of life, which I think that's really interesting. End of life, it really can affect the well-being of the patient, attitude towards death. It sort of gives you a mystical experience, which potentially reduces perceptions of pain, perceptions of what happens after we die. And there was also some plasma markers that for stress that were significantly down. So there's a study on alcohol dependence, end-of-life care. 2012, there's a study on smoking and alcohol dependence, where basically it deepened their spirituality and supported motivation for them to quit, maybe more than what we currently have on Chantix. Although, again, if you talk about smoking risk, the risk is typically more longer term, as far as lung cancer risks. The risk of psilocybin obviously is psychotic breaks, which can happen, and memory dysfunction, which can happen. It's pretty rare, and the toxicity level of LSD or mescaline or all these psychedelics is pretty high, meaning there's a pretty low therapeutic dose meaning you have effective treatment, you feel a benefit, and there's also what's called a lethal dose, which is called LD50. It's sort of this weird description of, if you give this dose to 100 people, half the people will die. This dose is therapeutic dose, and obviously you don't want those doses to be really close. So like Coumadin, there's a very narrow range for Coumadin to work, and if it goes to a level of 10, then there's some serious consequences on bleeding. So that window is really tight. The safer the drug, the higher this discrepancy is, therapeutic dose versus lethal dose. And interestingly, Tylenol is pretty tight. Like the effective dose and the lethal dose is pretty tight. And same with alcohol, and LSD tends to have a higher one. So as far as acute toxicity, it seems to be potentially less dangerous. Let's see here. And again, wanted to stress the point, there's no medical indications for this at the moment. But the biggest studies that are underway, and they're phase 2 and phase 3 at the moment, are treatment-resistant depression, PTSD, and potentially end-of-life care. The toxicity I talked about, long-term, there's some side effects. Obviously, bad trips, it can definitely trigger anxiety. Psychosis usually lasts, if you do have it, can last up to 48 hours. The likelihood of that happening is less than 0.08%. Suicidality can happen. That risk is about 0.1%. Addiction hasn't really been seen. They do addiction studies in monkeys to see if they'll actually choose the drug over even water or food. And the really high addictive drugs like crack cocaine and opiates, they'll actually choose the drug versus choosing water, where they really didn't seek out LSD, and actually they avoided it, probably because they had a pretty intense psychedelic experience. And humans have really no craving for the drug itself, and withdrawals don't really happen with it. So the other side effect potentially is a hallucination persisting perception disorder, where you have the trip and then weeks later, months later, you'll have, you'll see something off to the left of you. It's usually not persistent, but you'll see it and you'll really feel like it's there. And that can happen. So again, my point is, I think if you read all the articles, everything's all like, oh yeah, let's do it, let's legalize it, let's do it. We shouldn't do that. We need to have really good studies, prove that it works, prove that there's certain patients that will respond, certain patients that are probably more dangerous to treat, and maybe we shouldn't treat those people. And the most recent study that I saw, which I'll end with, was the Johns Hopkins study it was February. They tested 27 long-term depression patients who had been on medicines for an average of 2 years. 88% of them had previous treatment with many other medications. So these are people that have been in depression for a long period of time on multiple medications and still not really feeling like they're out of their depression. They gave 2 groups. One gave a low dose. Second group, they gave a high dose with a 6-hour prep, meaning they had 6 hours of psychological care. 2 doses were separated by 2 weeks, and then they were followed for 6 months to up to a year. And the depression score, there's a bunch of scores. They do it mostly for research. The depression scores range from 1 to 24, 24 being the worst. And on average, these people were 17 to 23 on their depression scale. After 2 treatments, followed for a year, they averaged a 75% response. 58% of them were considered in remission at 12 months. That's just remarkable. I mean, uh, and hopefully, again, we can have better ideas on who to treat with this, but it has such a huge potential response, especially to treatment resistant depression. And I think a lot of studies on end of life care. Now, the treatment for anxiety and all these other things is relatively new, but I think maybe for treatment resistant depression, it probably has the potential greatest effect on that. And again, these people have been treated with multiple medications over multiple years, and it just didn't work. And 58% remission at 12 months was pretty remarkable. So that ends my discussion. I'll look forward to doing my next one in probably 2 months. All right, have a good weekend. Bye.